Hello, my name is Dr. Brian Richards. I'm here to talk to you today about sleep apnea, specifically the Inspire device and how it can change your life when it comes to sleep apnea. First of all, sleep apnea is a common condition in the United States of America. What happens as we fall asleep is our muscles relax, everything but our heart muscles and our diaphragm stops moving so that we don't act out our dreams. But when that happens, we have relaxation in our throat, back of our tongue, and what can happen is the airway will close off as we fall into deeper levels of sleep.
There's a scale from mild, moderate to severe, depending on how frequently the problem occurs during sleep. So essentially, it's just a cessation of airflow that causes an abnormal drop in the oxygen, and there's kind of a downstream effect that results in increased blood pressure, heart rate, and a number of other things.
And can be bad for you, and you can wake up the next day feeling like you didn't get very good sleep. So the consequences of that are poor daytime production, just can't get things done, taking too many naps, falling asleep at the wheel can be a dangerous situation. You have bed partners who are mad at you for making so much noise at night, and there are issues related to the long-term effects on your heart and lungs. The mainline therapy for most people who have sleep apnea is to wear the CPAP device or a mask that goes over your nose or nose and mouth with the idea that it's going to blow air in to keep your airway open while you're asleep. So your muscles are relaxing, but the air will keep the tubing open just enough so that you can keep normal airflow going. And those are a great solution for sleep apnea, but they tend to be unpopular with patients.
And a lot of times people hesitate to be evaluated for sleep apnea because they think that there's no way they can tolerate using a CPAP or BiPAP. So we certainly help patients kind of walk through that process, see whether that is a possibility or not, and if not, there's a number of other options that we can pursue. The approach should not be CPAP or nothing. So if you're concerned that you may have sleep apnea, it's always best to come in and let us evaluate and see where you're at, and then talk about different treatment options so we can find something that works well for you.
That's where the Inspire device comes in. The Inspire device, instead of using air to blow your tubing open, uses your own muscle, your own tongue muscle, to create the airway that should be there when you're asleep. So the device is implanted in the chest, and it has a wire that senses when you breathe in. Another wire goes to the nerve that moves your tongue forward. So every time you go to take a breath in, your tongue moves forward just enough to create a space in the back of your throat, maintain your airway so that you're not having episodes where you're stopping breathing or nearly stopping breathing at night. This decreases snoring, increases airflow, and is an excellent treatment for sleep apnea. It works as well as CPAP for most patients, and for some patients it works better than CPAP. Now, there are other options for sleep apnea other than CPAP and Inspire. Weight loss is a good one.
So oral appliances, oral mandibular advancement devices, or mouth guards that pull your jaw forward while you're sleeping, which creates more space in the back of your airway. It helps. We use them a lot for patients who snore who don't have sleep apnea. But we also use them for milder cases of obstructive sleep apnea. And then again, if they're always better than nothing. So if we can't find anything more effective that is a good option, then we'll certainly try those as well.
But the main things we've tried to do in the past for sleep apnea have been surgery on the throat, weight loss, or the CPAP. Patients who decide that they want to go ahead and get the Inspire device need to be seen in the office, and we schedule them for a procedure where we make an incision in the chest, implant the generator, make a second incision in the neck where we find the nerve that moves the tongue forward. And through these two incisions, we're able to implant the device in a procedure that takes about an hour to an hour and a half. And we leave the device in for a month. We don't turn it on, let the body heal around it. And then a month later, you'll come in and meet with one of our sleep specialists.
So Dr. Richards performs the procedure, and then again, we give patients a month. You'll follow up with him, make sure your incisions are well healed and there's no abnormal bruising or bleeding or signs of infection, and then you'll return back to our office where we'll activate and turn on therapy and teach you how to use it. And then we have roughly monthly visits where we will reevaluate. It's what's called a cuff that attaches to the nerve, the hypoglossal nerve, and as you heal and the further away you get from the surgical procedure, the connection with the nerve can vary, and so that stimulus can become either more aggressive or less aggressive. And so we check that at each month and adjust therapy to make sure that it's effective and comfortable, and again, in an effort just to fine-tune and optimize therapy.
Studies have shown that a lot of patients who might have a sleep apnea score of around 30, after they have the Inspire device implanted, they'll drop that score down to about 6. Technically, anything below 5 is normal, so to be in the 5 or 6 range is an excellent response. And 88% of people are getting those sorts of results. So the vast majority of people have been very pleased with the results with their Inspire. Of course, not everybody likes everything, and it's not the perfect solution for everybody. But there has been a lot of work done looking at different studies that show the effectiveness of the Inspire device compared to CPAP, and certainly compared to non-treatment options. A lot of times people have been placed on CPAP, they have stopped using it. When I talk to them, they really haven't been using it for 3 or 4 years, which means their sleep apnea is basically untreated. That's an unacceptable situation. So to offer the Inspire for those people is a great option, because then they're at least getting treatment when they weren't before.
It has pretty widespread insurance coverage as long as you meet the criteria, which is, so you have to have had a sleep study within the last 2 years, a diagnostic sleep study with an apnea-hypopnea index between 15 and 65, and a BMI of 35 or less. And those guidelines are changing, or in the process of changing. The index is increasing from 15 to 100 rather than 15 to 65, and then the BMI is increasing from 35 to 40. It's kind of an ongoing process, but not complete yet. I think that's a good sign that insurances are seeing that, it's a benefit to patients, so we're trying to make it available for more patients.
Question to ask if Inspire is right for you is an excellent question. You have to have your sleep apnea score has to be between 15 and 100. Most people are in that range. You have to have tried CPAP adequately, given it a shot, and failed for whatever reason. And if you have any questions, you can either meet with us directly, or you can just call the number on the screen and we can get you more information.
Patients who have untreated sleep apnea are more likely to die from any reason than patients who are treated. So if that's not a big enough seller, I don't know what is.
I strongly recommend consideration of the Inspire device if you're struggling with sleep and struggling with sleep apnea. It's a great solution.